Hi everybody, my name is Ross Anderson. I'm one of the urologists at Urology Nevada. We're located in Reno, Nevada, and in this video series I want to talk about urethral strictures. This is meant to be a patient informational video to give you some information either before or after a visit. Thank you for your attention, and I wanted to first touch base about just the anatomy of the urethra to get everybody an idea of what we're talking about. The bladder here stores the urine, and then the P-tube or the urethra in men is pretty long, located here with the U or urethra, and that tube, its whole goal in life is just to empty urine. It passes urine to the outside world. Thank you for the attention during this video. I hope it's informational. A urethral stricture is scar tissue within the urethra. I've depicted it here with these black triangles, and when the urine tries to empty, it is really difficult to pass this smaller diameter lumen or the smaller P-tube because of the scar tissue. We've all seen the skateboarder landing on the rail, and you could see how that could cause a urethral injury. But traumatic injury is actually not the most common in the United States. Unknown or idiopathic is the most common reason we see in the United States, or we just don't know. But traumatic injuries, infections, or prior procedures are all common causes of urethral strictures. Urethral strictures are overall not very common, or about 1 in 200 men during the course of their life would have a urethral stricture. These become more common as men age, but can happen at any age, including during childhood. Urethral strictures are much less common in females, but do still occur. The symptoms men complain of with urethral stricture include difficulty urinating, like slow flow or having to push. It can also increase the frequency of urination or feel like they're not emptying the bladder completely. It can also lead to increased frequency at night. Very rarely it can cause some blood in the urine, and this is usually from the process of opening the stricture up slightly when men forcibly pee past the stricture. Very rarely men report urinary retention, where they end up in the emergency room because they can't pee. Men are often really good at living with symptoms of their diseases. This includes urethral strictures. So some men can live with a slow stream, but when it comes to painful urination or getting up lots of times in the night, this often leads to men seeking treatment. Other reasons why men seek treatment for urethral strictures is they go into urinary retention, go to the emergency room, and may have to have an emergent procedure to open up the urethra. The treatment of urethral stricture disease comes in two main forms. The first is endoscopic or minimally invasive with dilation or internal cutting of the scar tissue, and this procedure is good at opening up the urethra but does have a high failure rate. The other option is a surgical procedure, so more invasive procedure called a urethroplasty. And there's a few different types of urethroplasties, and I'd like to explain more about urethroplasty in another VidScript segment called Urethroplasty: What to Know. Thank you for your attention during this series on our introduction to urethral strictures. Visit our website at urologynevada.com for further information and contact information. Thank you very much.